All right, people, part 4 of fever in children. Today I'm just going to talk about how to treat fever. Now, remember, fever can be treated with Tylenol or ibuprofen, but remember, ibuprofen is reserved for only those children that are greater than 6 months of age. We don't like to use ibuprofen less than 6 months of age because of some significant complications that can happen. Also, we don't use aspirin, particularly in children, to reduce fever. So, mainly Tylenol, but we can also use ibuprofen to reduce fever in children. Just follow the instructions on the bottle. I don't want to give you a per kilo dose or something like that because it gets kind of confusing, but there is a weight-based guideline for how much to give based on the bottle and the concentration that you have. The other thing is that when we think about other ways of reducing fever, such as cool compresses or alcohol wipe downs and all of these kind of things, that is may have some benefit, but I don't usually worry too much about mechanical ways of lowering temperature unless that child is prone to fever seizures, like they've had them before, or there's a family history of fever seizures. They're in the 6 month to 6 year age group, but they just have a risk for seizures. Then I might use something to cool them down. Otherwise, I just use the Tylenol or the ibuprofen. Remember, when people get fever, they usually feel chilled and they want a blanket on. And it's kind of cold-hearted to take all their clothes off and trying to cool them down or put them in a cool bath. That certainly isn't what you would want if you had fever. So remember, you can treat the fever with Tylenol or ibuprofen. I don't know where the old wives' tale, it's like starve a fever, feed a cold or something. I don't know. That came from the Middle Ages. That has nothing to do with fever in reality. So Tylenol or ibuprofen. You can use mechanical means if you need to, but I would probably avoid those as much as possible. And for all of the caregivers out there, if somebody comes into the ER and they have fever, don't make them undress down to their underwear, or you can give them a blanket. You can give them something to keep them warm because you know that's what you would do if you were at home. Our set point changes, our thermostat changes when we have fever. So there's no reason to trying to mechanically cool an older child or an adult that's not at risk for fever seizures. All right, hope that helps. Again, I'm Dr. Joe Kraft, and this is the Medical Minute.